Hello, everyone. Good day. And once again on ID Med Health, you're with Osuji Chukwuebuka. And today we just want to discuss some of non-clinical health professions that can pay well. It's easy for us to think that the clinical setting, all we need to be found around the hospital is either being a doctor or being a nurse or being a pharmacist or being a medical lab scientist before you can work in the health sector. I'm here to tell you that there are other functional roles you can take in to and that will keep you in the hospital, and not just keeping you in the hospital, but with the legitimate aim of paying you well, making you live your dreams. All right. So we're just going to look at some of those um, professions, some of those roles that we can play as a non-clinical health worker, and as well earn well. Before I go on, I would advise you to quickly look below and you see the notification bell. Just hit it just to help us notify you anytime we release one of these beautiful videos. As well, you can follow us on our Facebook, ID Med Health. You can follow us on our Instagram, ID Med Health. You can also follow us on TikTok, ID Med Health. All right, thank you. So when we talk about working in the health sector, so many of us think that basically you must interface with the patients before you can possibly pass through to work in the health sector. But I'm here to tell you that that is not totally true, because there are so many functional roles you can take up in the sector without directly interfacing with uh, patients. For instance, I'm going to give you examples of improving technological system. Um, that a data analyst was working in the hospital, and what was he doing? Simply analyzing patients' records and properly putting them in the best statistical perspective. You know, so someone who has such skill is in high demand and basically needed in the hospital. We also have other roles as biomedical engineering, health informatics, even health administrators. The health administrators are basically there to keep records, and time has passed when you just need to be a nurse who is taking down the vitals of a patient and probably filing them in a particular uh, cupboard or whatever it is. Uh, these days, we have everything done with the software, and you basically do not need any knowledge of pharmacology or physiology or whatever to do this role. We also have a biomedical engineering, like I said earlier, and a biomedical engineer, for instance, all he just needs to do is make productions that can be of help to people's health. And I will give you an example. Now, I have seen some accessory uh, tools that can help people walk, like literally walk. Yes, people, they have to try to mathematically calculate um, the angles, and everything, every analytical element needed for people to walk. And probably maybe someone is lame or maybe had issues walking, they can actually design some of this apparatus to improve. It can be worn, or like to even be worn like a shoe or something, or attached to the legs for people whose legs are off, to enable them walk and lead their lives normally. You don't need to be a medical doctor, and this is advanced technology, of course. Like I said earlier, health informatics, that is where we're talking about data analysts. They use very wonderful um, programming languages to put through many things in the health sector and properly put the statistical perspectives of what is happening in the hospital in a better place, which is not going to be ragged. And these professions really, they pay well. you just need to know how to um, get into these professions, and I will tell you. But before I go on to tell you, in case you've not clicked on the notification bell, please try to click on the notification bell so that you'll be notified anytime we make videos like this. And also follow us on our YouTube. Oh, sorry, this is a YouTube. So also follow us on Facebook, of course. Follow us on our Instagram. Follow us on our TikTok. I'm going to go on and list out these health professionals that you can start thinking of, or health careers that you can start thinking of getting into if you are non-clinical. But I mean, if you're not a doctor, if you're not a nurse. So the first one is healthcare administrator. Like I said earlier, they are in charge of the management of the hospital system to make sure uh, the machines are supposed to be working, salaries are paid, uh, personnel management, which is basically salary payment and hiring. They are also in charge of day-to-day running of the hospital to keep it functional for doctors to actually do their work. So the next one, like I said earlier, is biomedical engineering. Now, can you think of someone you know who most probably got into an accident and probably lost their leg, and it was as if it's impossible for them to ever walk and lead their normal life? Now, there are biomedical engineers, and these people, like I said, help design tools and as apparatuses that can help people lead their normal life, or just by taking up angles and how mathematically the body is supposed to move, and they create things. For instance, you know of prosthetic leg. I mean, someone who doesn't have a leg, they can just look at the leg and probably do one or two mathematical calculations and produce a prosthetic leg, whom someone who is legless, if there is any word like that, could use to walk and lead their normal life without actually needing a crutches. I hope you understand what I mean. And there are a whole lot of things they can do. They design boots. There are people who have pains in their legs and all they need to wear is boots designed by these biomedical engineers, and they are they gradually become fine, or they do what they are supposed to do without so much of limitations. And the next one is health informatics. I told you these have come by where people actually carry pen and biro and go around the world and one, two, three, four, or stand by the door of the hospital to know how many people are coming in, how many people are going. No, some of these things are dealt with special softwares. Records can be kept accurately, which can help the hospitals in gaining external funds, knowing how they are functioning, knowing the demographics of people coming to them as well, knowing the diseases that are being taken care of in the hospital. So, I mean, health informatics, they just provide information on what is happening around a hospital, a clinical setting, a particular could be ministry or whatever. So they are always there. So these are also professionals or careers that you can also think of going into if you want to work in a clinical setting, in a clinical setting as a non-clinical personnel. One can also work as a pharmaceutical um, representative of a hospital. You don't necessarily need to be a doctor for you to, or a pharmacist for you to work as a pharmaceutical representative. All you need to do is have a marketing skills. I mean, you can sell a product to someone and convince the person to buy the product. You are good to go. So you don't need to study pharmacy to be in this kind of profession. However, you need a marketing skill. You need to know how to sell products for you to be able to sell drugs, equipment, what have you in the health sector to people who need them actually. Let's quickly go ahead to how do you get into this profession? So, for instance, the healthcare administrator, all you need to do is you can get into the university and study healthcare management as a course, or you can study public health as well, and any other medically related courses. You can as well study business management. Yeah, and or get a master's if you didn't do that in your first degree. You can get a master's, and you're good to go. Just polish your curriculum vitae, and you get into the job market, and probably land yourself your first role where you are going to be paid excellently. You can also be an accountant. I mean, a whole lot. Just know how to manage business. You are going to become a healthcare administrator. So for the healthcare informatics, um, yeah, healthcare administrator rather, you are looking at an average salary of $108,000 in a year. If you're somewhere in Nigeria, you're looking at almost 120 to 40 million naira in a year, and that's a wonderful amount of money to make. Uh, if you want to be a health informatics personnel, you need to have average knowledge of statistics, programming, or data analysis. Basically, you can grab the skill off the university. There are institutes that offer such skills as well. You can learn on your own at your own pace. You can as well get into the university to get a degree in data analysis, or you get a degree in statistics, or you get a degree in any of the programming languages, and you're good to go. And on the average, you're paid $100,000 at least every year, or as much. If you're in Nigeria, you can earn as much as 120 million naira in a year. That's a whole lot of money to make, you know. So the next one we're going to talk about is biomedical engineer. Like I told you, they are responsible. They responsibly make uh, from devices that can enable and make life easier for patients to softwares that are being used in the hospital as well. These people, for you to become a biomedical engineer, you actually need to study biomedical engineering in the university as a first degree course, or you can do specialize that if you were in your you studied any of the sciences. You can specialize as a biomedical engineer in your master's or PhD, whichever one you love, and you can earn as much as 140,000 US dollars if you are in the US, or you can as much if you're in Nigeria, you can earn as much as 170 million to 200 million naira. That's a beautiful thing. Before I continue, please, if you've forgotten, click the bell notification, and so we can notify you anytime I make these beautiful videos. You can also follow us on YouTube. I keep saying YouTube. You can follow us on Facebook, Instagram, Twitter. We're all the Idea Health, and we're always there to bring you the best of what you need. The next we're going to talk about is pharmaceutical sales rep. And what do these people do? Like I said earlier, they're responsible for um, to sell medical products to patients as well as hospitals that might be needing them. And you need to actually study any good, like I told you, you just need to be good in doing business. You just be good in doing business, right? I mean, you can sell, some people can sell their life, they can sell themselves. I mean, just be able to sell anything, and you're good to go. And just, these guys can earn as much as $100,000 in a year. Now, to so you get everything that you need. It's very important for you to take note that you need to get some degrees which are not necessarily clinical degrees. One, you also need to uh, get some certifications certifications. Thank you. And as well, you need to try your possible best to gain relevant experiences in some of these fields. For instance, sometimes because of the demands of this field, you wouldn't just walk directly into them. However, you can do the little stuff you can to make you proficient and make you sellable to the hospitals that will need your services. As well, try to network with people or professionals who are already doing these things to get first-hand experience of what and how they did this to get into the market. And it is very important also for you to make additional researches on your own to help you know exactly with specifics and not just any other specifics, location specifics of what you need to do to be into this wonderful careers. And if you want to see some of these beautiful videos again, maybe there is something you would need us to talk about, you can just write it in the comment section and we'll be there to feed you with what you need to know. If you've not liked or subscribed to our channel, this is the wonderful moment to like and subscribe to our channels to encourage us to do more of these videos and get you updated in things you need to know. Thank you so much, and we'd love to have you again here listening and viewing us and gaining as much as information you want or you need. See you some other time. I'm Ebenezer.